Every year, Newborn Care Week is observed across India from 15 to 21st November. The focus of this week will be on raising awareness about the care of newborn baby. The theme of this year is Safety, Quality and Nurturing Care, the birthright of every newborn. The theme aims to ensure that every newborn is supported with quality healthcare at all the service delivery platforms such as facility, community outreach, and homes. There are lots of points which we need to look into when caring for a newborn baby. Here are some of the important things which needs to be done as soon as the baby is being born. The first important one is umbilical cord care. During the pregnancy, the umbilical cord was a lifeline to the baby. However, after birth, it isn't required anymore. After cutting the umbilical cord, the stump of the umbilical cord remains in child's navel. Keep the navel area clean and dry. Disinfect the hands before handling the area. And look out for the signs of infection in the cord stump. If there is any redness, swelling, or smelly discharge in the navel area, take the baby to a pediatrician. Don't try to remove the stump as it will eventually fall off by itself. Next point to be remembered is breastfeeding. It can be started to the baby within half an hour or two after the birth. The initial milk is thick, yellowish and is nutrient rich, which is called as colostrum. The baby has to be breastfed every 2 to 3 hours, so we need to nurse the baby 8 to 12 times in 24 hours as breast milk contains vital nutrients and antibodies which are required for baby's survival and growth. Next step is initiating the breathing. Post-birth, the baby's lungs, which were previously filled with fluid, are now filled with air. This sudden shift can be difficult for the newborn baby. The first few breaths of the baby are usually hard, labor, shallow and irregular. This isn't a cause for concern as long as the baby's breathing steadies and normalizes eventually. Next thing is Apgar test. The doctor first performs the Apgar test in which he checks the appearance, pulse, grimace, activity and respiration. A score of 7 and above is considered as normal. A score of 4 to 6 is considered relatively low and score anything below 3 is critically ill. In case of low score, immediate intervention has to be taken. Next is weighing the baby. Weight of the baby is the best indicator of how the baby is doing. Most of the newborns weigh between 2 to 4 kg, which initially decreases and then increases. Next is skin to skin contact. Skin to skin contact is usually referred to as the practice where a baby is dried and laid directly on the mother's bare chest after the birth and both of them are covered in a warm blanket. Here, this encourages the emotional and social development of the child, and it also stimulates the specific part of the newborn's brain. Next is administration of vitamin K. Vitamin K is administered to the newborn baby in order to prevent any bleeding as it helps in clotting of the blood. The next is eye care. Newborn babies' eyes are extremely sensitive. Within an hour after birth, the doctor will put some eye drops in order to prevent any infection. Regularly wipe the baby's eyes with a damp cloth. Next step is hepatitis B vaccination. It is very essential as the disease is fatal. If a newborn's mother carries the hepatitis B virus in her blood, the baby must get the vaccine within 12 hours after the birth. And the baby also needs another shot of hepatitis B immunoglobulin in order to provide protection against the virus. Every vaccination is important for the child, so mark and ensure to get them vaccinated. Next is bathing the baby. Newborns don't need a bath every day. They rarely sweat or get dirty enough to need a full bath. But if the baby really likes bathing once a day is fine. Bathing more frequently can dry out the baby's skin. So make sure the water is lukewarm and not extremely hot or cool. Use a mild soap and shampoo for bathing the baby. Next step is physical examination. Like checking the Apgar, physical examination after birth is very much necessary to identify the congenital anomalies in babies. It is essential to examine the baby to see if he or she is healthy. Next is providing warmth to the baby. Swaddling the baby helps in regulating the body temperature. Wipe the child and dry immediately after a bath and make them wear warm clothes. The next step is how to handle a newborn baby. Here are few basics to remember. Wash your hands before handling the baby. Support your baby's head and neck. Never shake your baby whether in play or frustration. Make sure your baby is secure and limit any activity that could be too rough or bouncy. The last point to be remembered is provide tender loving care. Give the baby tender loving care and make sure that we should take good care of ourselves too.